Hello, I'm Dr. Robert LaBelle. Today we're going to be covering elbow pain and as well the home therapy program for elbow pain. This is an adjunct to the earlier video on elbow theory. Elbow treatment is aimed at reducing tension through this area. This is tennis elbow, as we've talked about, and this is golfer's elbow. Golfer's elbow is typically felt down the inside of the arm, and tennis elbow is felt down the outside of the arm. Initially, when we're starting to treat the elbow, it's sort of a threefold process. We have three different therapies. One would be stretching, so we'll go through that first. The stretching of the outside of the forearm, your arm will come up, elbow is straight. Ariana, can you please grab your hand? What you're going to do is gently pull down on your hand until you feel a decent pull here. We don't want you to be pulling into pain, but just a slight amount of discomfort. To augment that stretch and change the angle, you can rotate your fingers out and that'll start to pull a little bit more. That deals with the outside of the arm. To deal with the inside of the arm, what you're going to do is bring your fingers up, grab your fingers, Ariana, and you're going to pull back, and what you'll end up getting is a good pull in here, and this will start to deal with some of that golfer's elbow. And add on to this is to turn it in. Once again, that'll change the angle and you can feel a pretty decent stretch through those areas. All stretching should be done for approximately 30 to 60 seconds and done 2 to 4 times a day or as needed. You could be doing it up to 5 to 6 times a day. Make sure that there's no significant pain after stretching because that means you're probably stretching too hard. As well as the stretching, we very often show a home release program here at CCSR, and that's aimed at releasing the soft tissues, and it's an adjunct to the therapy that you get in office. So to show you, Ariana, I'm going to have you take your fingers nice and flat. We're going to release the outside of the arm here first, and we're going to do different angles. We'll end up treating down into here and then through here, and we're going to have your fingers move all the way down. With a reasonably significant pressure, what I'm going to have you do is just gently slide down quite slowly, and what you should feel is a little bit of discomfort and a good pull to the tissue. We call this self-myofascial release. It's very similar to the active release and the Graston technique that will be performed in office. If you bring your fingers up here, the majority of tennis elbow pain is located right at the attachment to the bone here, so you're going to want to make sure you get right near that bone and go down really slowly through there. That looks wonderful. To treat, good, that's awesome. To treat the inside of the elbow, we're going to work through the common flexor tendon attachment here. And same thing, Ariana, what I'm going to have you do is put your fingers up near the attachment to that bone right there, and then we're going to have you slowly slide down. And she's doing this at a really good pace. It's done slowly. She's probably feeling a mild amount of discomfort, not too much pain. We're really looking at whether you're treating tennis elbow or golfer's elbow, you're really looking at doing 3 to 5 minutes of this 2 to 3 times a week. You cannot do it daily because you'll cause too much of an inflammatory response, and we need time for the tissue to regrow and regenerate in there. That's really the point of this exercise. You're breaking down scar tissue so that new tissue will grow into the area. As well with this one, make sure that you're hitting different angles as you go through there. That looks really good. The third component to the home therapy program for elbow pain is an exercise we call eccentric strength training. It's done with a weight or a TheraBand, so if you grab the TheraBand, eccentric strength training is the lowering portion of an exercise. If I was to do a bicep curl, my bicep would shorten. That's a concentric exercise, and as I'm lowering a weight or a band down, the bicep is elongating, and that's known as eccentric strength training. Eccentric strength training has been shown in sports medicine literature to actually cause new tendon growth, new collagen growth, and that's what we're really looking at doing in any of these tendinitis type of conditions. So to show you eccentric strength training, it's quite straightforward. You step on the band, you want to develop a considerable amount of tension to the band, and we're initially going to go through the treatment of tennis elbow or the extensor tendinitis issues. Basically, with your hand down, you want a reasonable amount of pressure on the band. With your opposing hand, you're going to grab this hand and you're going to elevate this up. As you elevate the hand up all the way, What this does is it concentrically contracts. Remember, we're not trying to do that. And you're going to let go here, Ariana, and then you're going to slowly lower the band down at a pace of about 3 to 5 seconds. What's happening here is the tendons are elongating, there's a pressure that's put on the tendons, and subsequently the tendons will become mildly inflamed and they will regenerate. We're going to do 3 sets of 12 reps of that, and once again, similarly to the release, we're not doing that every day. We're going to do that 3 times a week or 2 to 3 times a week. We need the tissue to regenerate in your down times. So that deals with the tennis elbow or the lateral tissue. If you turn your arm over, this is how we deal with golfer's elbow or medial epicondylitis. Once again, you lift the hand up and that concentrically contracts, and then you slowly lower down at a pace of 3 to 5 seconds. Once again, you'll do 12 repetitions, you'll take a minute break, and then you'll do another 12. 3 sets of 12 repetitions done 2 to 3 times a week. Over a 12-week period, research has shown that this will really help your tennis or your golfer's elbow and help rebuild the tendon.